India. So Heal by India and Heal in India are two complementary Government of India initiatives. Heal in India promotes India as a global destination for affordable, high quality and holistic medical wellness and care. While Heal by India focuses on sending Indian healthcare professionals abroad through safe, regulated workforce mobility mechanisms. Now, what is the objective of Heal by India? So this initiative aims to provide a global platform for AYUSH students and practitioners. It focuses on capacity building so that they can develop the skills needed to work anywhere in the world. It also aims to open the pathway for global empowerment and create international career opportunities. At the same time, it supports the vision and the theme of Heal by India, promoting India's traditional system of medicine at the global level. Next, what is the Heal by India focused on? So it focused on the basic competencies, background studies of like different country wise, body language and good manners, language and accent training with the help of the interpreter or the translator, communication skills, professional skills, and consultation skills. So let's talk about the basic competences. So basic competences is about the basic knowledge of Indian culture, philosophy, spiritualism, the knowledge of principle and practices of yogas, in-depth ideas of ASF terminology, like understanding the difference between the word and terminology. Word has a meaning and terminology has a definition. So avoid translating the technical terms like vat, we could not be translated as wind, pitta, we could not translate it as bile, and kapha, we can't translate it directly as welcome. Next, they should be proficient, like there should be proficiency in English. So these are the basic competences. Next, before going for the body language, first we should also know about the background. Like we should do a background study of the country, like where we are going to treat or where from where the patient is coming. Like the local language we should know, the culture and the traditions we should know, the important laws and regulations we should know, the lifestyle and outfits, the food habits, the festivals, the climatic condition, the local herbs, medicine or treatment materials, the health journal and media, and relevant medical system of that particular area. We should know this. Why we should know this? Because while when we are also going there, we should know what are the climate, what are the rules and regulations to to going there and practicing our Ayush system of medicine. So we should know all these things. Along with if the person, some persons, some foreigners, if they are coming in India for the treatment, so we should also know about their food habits, their climate conditions, their traditional medicines. So all these things which will ultimately help us to treat a patient. Along with that, if we are settling down somewhere else, some other countries, so we should be also not having that much problem while we are settling there. Next, let's come to the body language. So definitely language verbally, like verbal communication is very much needed while practicing, but along with the verbal communication also the non-verbal communication is also necessary, which involves the body movements, right? So we can convey a great deal of information without even speaking, like with the help of gesture, posture, expression and movement. And it is said that communication involves three elements: word 7%, voice tone 38%, and movement 55%. So while dealing with patient, we have to consider these things also. So now about the good manners. So what are the good manners for a physician? It's like we have to dress like a professional. We should introduce yourself properly. Make eye contact with patients while talking with them. Smile when you make eye contact. Practice the professional meetings and greetings. Be patient. Look and listen, and don't talk too much unnecessarily. Like when you are asking any kind of critical questions, like you make sure that you are paying proper attention to that particular answer. Use the patient's name while you are talking. and let the patient know what is actually going on, or what is going to happen. Next, come to the language courses. So here we are taking the patient, or we are considering the patient under the Heal by India initiative, right? So here we are dealing with the foreign peoples or foreign patients, for like foreigners. So there definitely there would be like difference of languages. So by the help of the language course, we should understand about the difference between the language, the dialect, the accent, and we should learn also some of them, right? From where we are going, or from which country the patient is coming, so we should know that. So language, like suppose for example, like if the person is coming from Spain, right, and he is talking in, or she is talking in the Spanish language, but we don't know that, and we are talking in English, so there will be a communication gap, right? So we can treat the patient properly because we are not able to understand what they are going through. Same for the dialect also, we should know the dialect also, how the British English, for example, the British English and the American English, right? So these two are the dialects are different. So if we don't know that also, some maybe there is a chance that we should miss some word, or we should misinterpret it, and we are so that will be coming, and that it will it will come in that treatment. So we can't treat that patient properly. Next, let's come to the accent. So suppose, for example, like if a native English speaker, when they are speaking in English, it will sound differently. Then compare if a suppose a French speaking person, he is speaking in English, right? So that accent will be different. So we should know that accent also, so that we can treat the patient properly. We can know what he is actually trying to say, or he is saying. So by that we can treat the patient properly. Next, come to the communication skill. So communication skill, if we are talking about that, so it can be divided into two ways, like brain to brain and heart to heart. So what is brain to brain? Like in patient treatment, uh, like always use the brain to brain skills for the logical side of care, like explaining the diagnosis, the test results, and the treatment plans with clear facts and evidence. It is slow and analytical processing, right? To build trust through transparency and help patient understand why a medicine or a procedure is work. For example, break down like the lab values step by step, or use simple diagram during the consultations. Next is the heart-to-heart in patient treatment. It is applied by listening to the patient's story, showing empathy, and sharing like relatable narratives to address the fear, hope, and daily impact of illness. Narrative medicine techniques like reflecting back what the patient says. Like suppose we can start conversation like it sounds like this pain is like disrupting your family time, like that. So this is like fast and emotional processing, so it is for better adherence and emotional relief. So when we are treating a patient, we should combine this both for the better outcome. Always start the conversation with heart to heart to connect emotionally and reduce the anxiety of the patient, and then shift to brain for detailed education. Like in Ayurvedic practice, suppose for example, like we can pair the dosha explanation, right? So that is the brain to brain, and when we are actually relating it with the patient life stories, so that is the heart to heart, and by this we can personalize the treatment very effectively. Next, come to the skills. So first we will talk about the professional skills. So a doctor or an Ayurvedic doctor, definitely, who is going to treat the patient, he should know about the integrated abilities, the knowledge, the technical expertise, and the behavior. Such, for example, like how to do the diagnosis in Ayurvedic way, the pharmaceutical preparations which we are using, or which is like the standard according to the NCISM, the empathetic communication, the ethical practice, and the clinical reasoning that characterize the competent patient-centered care while upholding professionalism, like in core attributes like accountability, empathy, integrity, and continuous learning. Next, come to the consultation skills. So in Ayurveda, integrated integrated treatment procedure or the classical concepts with like darshan, sparshan, and prashan, right? To holistically, like if we access the patient's health. So here darshan involves a careful visual examination of physical signs such as like skin, tongue, eyes, and overall appearance. Sparshan here includes the palpitation methods like the nadi pariksha. So Nadi Pariksha we are doing to evaluate the dosha imbalances, right? Then the prashna. Then it comes about the consistence of questions, like detailed questioning about the symptoms, the lifestyle, the diet, the mental state to understand the patient's condition comprehensively. These methods combined with empathetic communication and clear explanations enable the Ayurvedic doctor to accurately diagnose, individualize the treatment plan, and engage patients in their healing process effectively, embodying both scientific and compassion.